Hi, Mrs. Drinkwine.
Hi.
Nice to meet you.
Nice to meet you.
My name is Cristina Bowen. I'm going to be your student physical therapist today. I just want to let you know what we're going to go over today. So right now I'm going to ask you a couple of questions. It should take about 15 minutes just to get the background of what's going on. And then we're going to move into the portion where I'm just going to, test your muscles and see how you move, things like that. That should take about 30 minutes. So we'll try to get you out of here in a timely fashion. And if you see me writing anything, I'm just making sure I get all of the details down that are important. So thank you for being patient with me in advance.
That's fine.
Yeah. So just gonna start. Could I have your name, please?
Yes. My name is Helga Drinkwine.
And what's your date of birth?
My date of birth is October 9, 1994.
Okay. And what brings you into physical therapy today?
I have this really bad pain on the back of my left leg.
Okay.
Yeah.
Sorry to hear that.
It's been really stressful lately because of it.
I'm so sorry about that. We'll try to help you out. And have you ever been to physical therapy before?
No, I haven't, but I do have a friend who has been to physical therapy, and she said that her pain was worse, and I'm just really scared about that. I don't want my pain to get any worse than what it already is.
I'm so sorry to hear that they don't have a good experience. We're gonna do everything possible to make you feel comfortable here in the clinic. If you have any questions or concerns, please let me know. We'll try and adjust. And so, what do you do for a living?
I'm a dancer at SeaWorld.
Oh, very cool.
Yes, I'm a backup dancer. I wear this costume of a chipmunk. His name is Punky, and it's just a heavy suit, but it's really fun.
Yeah?
Yeah.
Oh, I bet. And what kind of physical activity does this require? I know you said dance.
Yeah, so I just need to be standing up for most of the time, and I dance. Sometimes I do like these parts where I jump a little bit, so that would be something that would be required for my job too.
Are you having trouble with any of these things right now?
Yes, I haven't been able to dance very well because, like I said, I have that costume that I have to wear, and it's just really heavy. And so with this pain in my leg, I haven't even been able to dance.
Oh, I'm sorry to hear that. We'll definitely try and get you back to dancing. It sounds like something you're really passionate about.
Yes, I really love it. I enjoy doing that with my friends too.
Yeah, you like to do it outside of work too? That's great. And so what other hobbies do you have outside of work?
So, like I said, right now I love dancing, and I like going out for drinks occasionally with my friends from work.
Oh, that's fun. What kind of dance do you like?
I like ballet, and sometimes I like dancing bachata.
Oh, very cool. And how many times a week would you say that you usually dance?
Almost, I guess I would say 5 times a week. Yeah, I just really love it.
Yeah, sometimes, it's great, right? Just have something that you love. I would do it all the time too if I knew how to dance. And so what kind of place do you live in?
I live in an apartment, and I have to go up some stairs.
Are you having any difficulty with that right now?
A little bit. Not. It's more like knowing how to move the crutches.
Oh, okay. So are you using an assistive device? Just crutches?
Just crutches. Just crutches.
Oh, okay. And how long have you been using those?
For the last 4 weeks.
Okay. And is there anyone at home that can help you do all of the activities that you need to get done around the house?
No, I live by myself.
Okay. Do you know any of your neighbors? Anybody that can help you out?
No.
Okay. Well, we'll try and get you as functional as possible so you can return to doing all the things that you need to do at home. So we'll just try and make it easier for you.
Okay.
And could you show me exactly where you're feeling the pain?
Yes, it starts here, like up over here, and then it goes down over here to my, just in this area.
Okay. Would you say that you feel anything below that?
No, not at all.
Okay. And what about above that?
No.
Okay.
It's just right in my back leg.
Okay. And how would you describe that pain?
It's very achy. It's just achy.
Yeah.
Yeah.
Oh no, that's never good,
No, it hurts a lot.
On how would you rate that on a scale of 0 to 10? 0 being no pain, 10 being the worst pain in your life.
So
How would you say right now? We'll go with right now.
right now
Mhm.
it would be a 1.
Okay. And how about at its best?
At its best, it would be a 0.
And at its worst?
It would be a 6.
Okay. Thank you for that. And are you feeling pain anywhere else?
No, it's just in the leg.
Okay. And so, what would you say makes the pain worse?
I can't really walk for long. If I walk for 2 minutes, it'll begin to hurt a lot.
Oh, okay. It's pretty quick.
Yes, that's why I haven't been able to dance because of it.
Mm-hmm. And what do you say? What would you do to make it feel better?
To make it feel better, I just rest and I ice it. That's what my doctor recommended. I do some elevations too, and well, the crutches really help.
Oh, okay. Oh, that's great. And so, how would you say you feel in the morning when you wake up? How does the pain feel?
In the morning, it feels a bit stiff.
A little stiff?
Mm-hmm.
And about how long does that last?
I'd say around 3 minutes.
3 minutes?
Yeah.
Is there anything that you do to make it feel better? To feel less stiff?
I just move it a bit, and then it'll help it be less stiff.
Okay. And how would you say your leg feels throughout the day?
Throughout the day, it just really depends on what I'm doing. If I walk for long, then I'll be in a lot of pain. But
Mhm.
if not, then it doesn't hurt as bad.
Okay. And how would you say it feels at night?
At night, it is painful, but I like with my medications, it really helps me be able to sleep.
Okay. Does it keep you up at night?
No, with medications, I'm fine.
Okay. That's great to hear. And now I'm just gonna look over the intake chart that you filled out for me. And I see here that you said that you are feeling a little down and depressed and hopeless. How long have you been feeling like this?
Ever since the injury, really, it's just like I said, dancing is something that I really love doing. It's just my way of expressing myself, and not being able to dance, it's really depressing. It hasn't been good at all.
Yeah, it's a part of you.
Yeah.
We'll definitely try and get you to dance as soon as possible so you can also feel better, not just physically, but, emotionally.
Okay.
And I also see that you said that you drink.
Oh yes.
About
I love martinis.
How many times a week do you think you drink?
Around 3 times a week.
3 times. Okay. And I also see here that you put that you do have a neurological disease. Could you tell me more about your anxiety?
Yes, I get really anxious at times. So like, right now I feel a bit anxious about this because, like I said, my friend, she said she had a bad experience, and I just don't want my leg to get any worse. I really want to get back to dancing. So I am taking some medications for it.
Okay, well, anything we can do to make you feel more comfortable around here, please let me know. We don't want you feeling anxious when you come into the clinic. We want you to feel like this is a very welcoming environment.
Okay.
And I also see here that you put that you have had prior surgeries.
Oh yes.
Could you tell me more about that?
That was when I was 18. I was a cheerleader in high school, so I got injured and I had a labral tear, so they just had to repair my right hip.
Oof, that sounds pretty painful.
It was really painful.
Were you able to get back to cheering?
No, not really. It was kind of towards like the end of the year, so it was fine.
Oh man, sorry to hear that. Let's see. And I also see that you put that you suffered a trauma with this incident. That's accurate?
Yes.
Okay. And then, have you had any imaging done for this injury?
I did. I had some X-rays done.
And how long ago was that?
It was around like when I had the injury. That's when I went to get the X-rays, and I also had an MRI.
Okay. And do you know the results of those?
Told me it was a grade 2 hamstring strain.
Okay, thank you. And what medications are you taking, if any?
I'm taking Mopic.
Mopic?
Mm-hmm.
And could you tell me how much?
I usually just take whatever is prescribed on the bottle.
Okay. And going back to the form, I see here that you put that you learn best by doing. Would you find it beneficial for me to demonstrate, exercises that I might send home with you?
Yes, definitely. I'm a very visual learner, so
Okay.
that would be very helpful.
I will definitely try to incorporate that. Anything to help you have a speedy recovery.
Thank you so much.
And could you tell me a little bit about how your injury occurred?
Yeah, so I was standing on this 3-foot tall pot in front of my porch. I was trying to decorate it, so I was like hanging up some flowers, but I then lost my balance, and then I was gonna fall, and as I was like trying to land, I saw that my dog was right there, like next to
Oh
it. So
no!
I didn't want to step on him, and I just ended up landing super awkwardly, and that's ever since then I've just had the pain in my leg.
Oh, I'm so sorry to hear that. But it could have been much worse.
Yes,
Yeah.
I didn't want to get my dog hurt at all, so it's okay.
When would you say the pain started?
My pain started 4 weeks ago.
Okay, so right after the injury?
Right after the injury.
Okay. And how would you say your pain has been since?
It hasn't really been changing.
Okay, it's about the same. And have you ever injured this leg before?
No.
This is the first time? Okay. And so now I just want to know how can we help you? What do you want to get out of physical therapy?
So I definitely want my pain to be reduced because I want to get back to dancing, and I would also run, and I haven't been running ever since then because of the pain.
Yeah, that would be pretty difficult, I assume.
Yeah, I can barely even walk, much less run.
Well, we're gonna try and get you back to doing all of that stuff, and you let me know if there's anything that we can do to make your time at physical therapy more enjoyable, more effective. But we're gonna do everything in our hands to get you better. So I just want to thank you for all the information, and now we're gonna move on to the section where I just assess your movement and your muscle strength. So yeah.
Thank you.